Hello, my name is Rachel Welling, and the practice setting I will be discussing is forensics and prison. The role and responsibilities of the forensic, psychiatric, and mental health nurse practitioner are as shown here. They are required to complete psychiatric assessments, prescribe psychiatric medicine, educate correctional officers about mental health issues, and provide therapeutic services to victims and witnesses of crimes. Now, our TSI textbook goes into detail about two other roles that are considered forensic, so I wanted to include them. The legal nurse consulting works with attorneys, performs case analysis, and provides expert witness testimony. And then, of course, the sexual assault nurse examiner collects evidence and provides expert testimony about the evidence found and work collaboratively with law enforcement and prosecutors. Population of this role includes anywhere that criminal justice meets the need for psychiatric nursing. So that includes community treatment, jails, prisons, and state psychiatric hospitals. It is important to note that most admissions to inpatient care are court-ordered. The largest area of forensic practice is in corrections, so prisons and jails. 10% to 16% of inmates in state prisons have mental disorders. And actually, an overwhelming number, 66% of inmates fake a mental illness. So that still falls on the provider to diagnose correctly and not diagnose appropriately. Which leads me to the challenges of forensic settings, especially in prisons. Malingering is faking symptoms of mental illness for ulterior gain. This could include a lesser sentence, transferring to facilities, or whatever the inmate thinks that they can manipulate to benefit them. We as nurses are usually empathetic by nature, and some find it difficult to empathize and treat someone that is considered evil or a criminal. Of course, if you can overcome that and do show empathy towards the inmate, you run the risk of them exploiting your niceness to try and gain something from that. And there are a lot of cases that show that has happened. As for education, of course, you should be an advanced practice registered nurse. For LNC and SANE, training varies from state to state and program to program. Now, you do have to be an RN to be a sexual assault nurse examiner. However, the PMHNP is not a requirement, though a lot of psychiatric and mental health nurse practitioners do perform this role. For corrections, like prison and jail, additional education is often advised for ruling out malingering. That is an option to providers because it is something that seems to come up a lot. To work in forensics, one needs strong interpersonal skills, and you should be aware of your own feelings and biases towards criminals and those incarcerated. You also need very strong boundary navigation. It's often suggested not to get too emotionally involved with your patients, especially in the forensic setting. However, being under-involved can be just as detrimental to the patient's care. You also need to have excellent therapy skills. Many inmates have low IQs and limited reading and writing ability. Many have not graduated high school. So it may be difficult to obtain successful results with cognitive behavioral therapy and therapies such as that, but there has been known success with dialectical behavioral therapy. So you just have to be aware and have a wide variety of therapy styles in your belt. It is important to note some ethical dilemmas that may come up. Oftentimes, with therapy being court ordered, or if you're working with an inmate, you run into the patient maybe not actually giving consent, but are there because they don't have a choice. So that can kind of get hairy, consent versus assent. and kind of who do you look for to get consent for certain therapies or medication adjustments when it's probably not the patient themselves that are making their decisions. And of course, Tarasoff law is the responsibility to warn others of harm. And you could run into issues with this in especially the prison setting. If your patient tells you he wants to hurt another inmate, do you tell the guards and risk the patient being punished, and which could ruin the rapport that you have made with them? Do you tell the other inmate, which could start a conflict between the two? There's just a lot of problems that could arise with that, but of course you have a duty to do no harm. And then for expert testimony, you can always be asked to provide testimony for crimes that could show innocence by insanity, or you could give your opinion that they're not competent to stand trial. And then you have to kind of live with, or at least know that what you say and what your opinion is directly affects the victims and the families of victims. And also, you're saying that yes, they are insane, no, they are not, could greatly affect their sentencing. As I said previously, certification requirements vary from state to state. There are 2 sexual assault nurse examiner certifications you can get, and one, SANE A, is for adult and SANE P is for pediatrics. Of course, you should be certified for psychiatric and mental health. And there's also there's actually a forensic certification that you can get, and that is Advanced Forensic Nurse Board Certified. None of these are required. And these are my references for more information about forensic issues and psychiatric syndromes that you mostly would run into in the forensic settings. It's in the Tsai and Fitzpatrick book, and that's chapter 21.